Welcome back. Dr. Gehann D'Souza has been joining us to speak about the services he offers through Tri-City Medical Center at his offices at the Iconic Plastic Surgery.
Right, Kelly, Iconic Plastic Surgery. And so we have an office in Carlsbad, California, and we service all of Southern Orange County and San Diego.
What's interesting to me is that this is called Iconic Plastic Surgery, and this segment is talking about migraine surgery, and you see patients initially through this clinic. Why is that?
Absolutely. So migraine surgery is a brand new field of medicine, and it was discovered by plastic surgeons, and that's why plastic surgeons have really propounded this field and really taken it into the 21st century. And so what we used to see when we did plastic cosmetic surgery is that we would be releasing the nerves that caused migraine surgery during our cosmetic operations, and the migraine headaches would really go away in these patients. And so we did a lot of research in Cleveland, where I trained, about this field, and that's why we can offer this great treatment out to all our patients.
Because I think I heard before something like when is it because of, you were saying the Botox, that it would release a nerve or something like that?
So here's what happens, Kelly. So you have all these nerves that give sensation to the face. The nerves come from the brain through little holes in the skull and give sensation to different areas of the face. And so what happens is sometimes those nerves can be compressed or sandwiched between the bone, muscle, or fat. And so if you paralyze the muscle or cut the muscle out, the nerves basically lose that compression and the migraines or the sensation diminishes and goes away.
So what is a migraine headache, and how does it, and who does it affect?
Right. So migraine headaches are these intensely painful headaches that affect 35 million people in the United States alone. 1 out of 4 households in this country have a member of the household affected by migraines. So it is a pretty big deal. Women get migraines more, older people also get migraines more, but migraines can affect anybody.
Mm-hmm. And what are some of the traditional therapies?
So some of the traditional therapies for migraines are pain medications like Tylenol, Motrin. You can also get specific migraine medications that affect the nerves on a really molecular basis. But these things only decrease the headaches or decrease the pain while the headache is happening. They don't cure the headaches completely. And that's where plastic surgery comes in for migraine surgery.
So when someone comes to Iconic Plastic Surgery, and because it's on your website that you do this service, could you talk me through what happens?
Absolutely. Yeah. So the first thing we make sure is that the patient has seen a neurologist, and the neurologist has to diagnose the headaches as being migraine headaches, because there are different kind of headaches that a patient can have. Once the neurologist has seen the patient and they come to our clinic in Carlsbad, what we do is we give the patient Botox injections. And then we send the patient home for 3 weeks with a little diary. And we ask the patients to write if they've had migraine headaches, what time of the day these headaches have come on, if the Botox helped the headaches, and where exactly on the face the migraines have occurred.
Oh, that's interesting. So what preoperative tests are required prior to undergoing this?
So like I said, number 1, they have to see the neurologist. Number 2, we inject the Botox, and they keep the whole diary throughout the Botox treatment time. And so those are the main preoperative tests. There's nothing more. They don't have to go through any CT scan. They don't have to take any really large invasive tests.
So I know that we spoke before that when you have Botox, sometimes people need to come and get that again. Is that a similar thing you found with the migraines, like it stopped for a while and then they had to come back in?
Absolutely. So the way Botox works is it paralyzes muscle. So if you paralyze a muscle that is compressing or sandwiching a nerve, then the nerve has room to breathe and room to live and won't be giving you the pain that can result in a migraine. But Botox only lasts for about 3 to 6 months. So a Botox treatment is only a temporary cease to these migraine headaches.
Okay. And what are migraine trigger points?
So migraine trigger points are those specific nerves. And so if somebody comes and tells me, oh, I get migraine headaches here, that's caused by nerves over here. If somebody tells me they get migraine headaches in the back of the head, that's caused by nerves in the back of the head. And so if we know exactly which nerves we need to target, then we can actually prescribe a surgery that deals with that particular nerve and that particular migraine.
So you would, if it's, let's say, in the back of the head, is that still Botox back there?
So there's Botox back there, and then the surgical option is we make a tiny little cut that's well hidden in the hair. We find the nerve, and we look, and we see, oh, this nerve might be sandwiched by fat, or this nerve might be sandwiched by muscle. If we can see that muscle and fat, we basically cut a little swatch of the muscle around the nerve and enable the nerve to be less compressed or sandwiched.
So in the case of I guess whether it's the back of the head or even the front, is that a surgery done by the neurologist or is it done by the...
So correct. So neurologists don't do surgery, and that's where the plastic surgeons come in. So the neurologists will tell us this patient is having a migraine. Then we take it on from there. And so what we do is we actually operate on that patient. We make the cuts in surgery centers or in the operating room.
So between the Tri-City Medical Center neurologists and you all decide where this is as a I guess together?
Absolutely. So we talk to the neurologists, we also speak with the patients, and we kind of all formulate a plan as to figuring out what's best and what the best option is for this patient.
Okay. And you already said what migraine surgery is like. Is there anything that you would add to that, recovery time or anything?
So migraine surgery uses the same incisions as any other plastic surgery procedure. So in the front of the head, we use the same incisions as a brow lift. In the area of the eyes, we use the same incisions as a blepharoplasty or eyelid surgery. And so the recovery time is actually very, very quick. For the front of the head, it might be about a week. For these eyes, it might be 2 or 3 days. And for the back of the head, it might be about 3 to 5 days.
Okay. And what are the outcomes of this?
So we've looked into this extensively at the Cleveland Clinic and in Cleveland where I trained. And the outcomes were in 80% of patients, in 5 years, their migraines completely went away. And their migraines were kind of dissipated in these patients.
So you would say that it is a success.
It's an absolute success.
Okay. Well, we want to thank you so much for joining our show, Dr. D'Souza, Dr. D'Souza, and we want to thank you for all the work that you're doing there in Carlsbad, for sure.
Okay, thank you, Kelly.
And thank you for joining us. You've been watching KOCT's What's Happening at Tri-City Medical Center. To view past episodes or for more information on KOCT's programming, visit koct.org. I'm Kellie Davis. Thank you for watching.